Hey everybody, I'm April Phelps. I'm one of the online MLT to MLS students, and my micro case study is on C. diff. So just some patient info. The patient is male, 54 years old, and was admitted to the hospital with severe sepsis and fever in June of 2012. Patient history, he was diagnosed with rectal adenocarcinoma in June of 2010. A colostomy bag was required post-op, along with chemo and radiation. During the chemo and radiation, he developed recurrent UTIs that were treated with multiple courses of antibiotics. A few months prior to his hospital admission, he developed an abdominal abscess that was also treated with multiple types of antibiotics. So just some labs that were collected. Hematology, the WBC was elevated at 15,200 with a significant increase in neutrophils at a little over 12,000. The hemoglobin was decreased at 10.3. In chemistry, the CRP was significantly increased at 276. The microbiology testing. Blood cultures were collected when the patient was admitted during his fever. An anaerobic gram-positive bacillus was identified. A stool sample from the colostomy bag tested positive for glutamate dehydrogenase antigen using C. diff quick check. Culture on selective media, TCCA, was positive for C. diff. So the findings, the patient was diagnosed with C. diff. Here is just some random information about C. diff, also known as pseudomembranous ulcerative colitis. It's a gram-positive bacillus. It is anaerobic, spore-forming, and can be normal flora in some people. And the picture to your right on top is actually C. perfringens. It is shown because C. diff isn't usually cultured, but it is similar looking to it, just a little bit longer. Treatment, he was treated with 500 milligrams intravenous MTZ, an antibiotic that is normally used for anaerobic bacterial infections, for every 8 hours for 3 days. After the initial treatment, repeat blood cultures and stool cultures were negative. Treatment was switched to 500 milligrams oral MTZ every 12 hours for 17 days. Patient then recovered and was discharged. Isolates from the stool and blood cultures were sent to the National Reference Laboratory for C. diff. Both were positive but did not produce the binary toxin. Here are just some symptoms of C. diff: watery diarrhea multiple times a day, fever, nausea, increased white blood cell count, and sepsis. So here's just a side note. For some reason, this case study didn't say whether or not the patient had diarrhea. I don't know if they just forgot that particular symptom, but it is one of the main ones, so I did some reading up on it, and C. diff, in particularly critically ill patients, C. diff may occur without diarrhea. This can occur because the patient has a pre-existing ILIS or because the ILIS develops as a result of C. diff. So C. diff should always be suspected in patients with marked leukocytosis and abdominal pain. And an ILIS is just a painful obstruction of the ileum or other part of the intestine. And I included a little picture there to show where the ileum is located. And you can see my cat in the background. So just some thoughts. The patient had been taking multiple antibiotics which killed his normal flora, leading to his diagnosis. In my opinion, since he had been diagnosed with rectal adenocarcinoma and an abdominal abscess before his hospital admission, he didn't get the symptom of diarrhea, going by my previous slide. Seems like it just kind of skipped that symptom, leading to sepsis. And just some miscellaneous information. C. diff is highly contagious. Healthcare workers not washing their hands in between seeing patients is one of the many ways it can be spread in between patients in hospitals or nursing homes. The stool is also very stinky, and you will never forget the smell. I know this because when I would do phlebotomy, I could instantly tell whether or not someone on that particular floor, if they had C. diff or not, just by that smell. And there's nothing to compare it to. I just know that it burns your nose. And that's when I figured out staying in the lab is for me. And I believe that is it. And here's my works cited, but so thank you. Good luck on finals.